Facelift. Get rid of the mask of wrinkles, lines, crow's feet and sagging jowls from your face. Our combined 50 years of experience using microelectronic neuromuscular stimulation, or MENS for short, MENS actually, ensures excellent results. Take off the mask of wrinkles, lines and the ravages of the years by using subsensory microelectronic neuromuscular stimulation, also known as MENS. It works by stimulating the mitochondria to produce adenosine triphosphate, or ATP for short. It opens the capillaries and turns the slack small muscles in the face and neck to achieve an outstanding filling out and tightening of the skin, fading lines and blemishes. Men can also benefit from this as well. I mean, I was a wonderful example of that. This is my wife and I, who've been in this for many years, and we are in our 70s. Combined 50 years of experience doing facelifts where MENS, microelectronic neuromuscular stimulation, obtains excellent results. The modality has also been used to help people for treatments ranging from arthritis to poisonous bites of various types, tennis elbow, ulcers, wounds and knitting of broken bones in up to a third of to half the time. This is non-invasive and means we do not prick, use Botox, cut, pull or cause any distress to our clients. The system we use mimics the microelectronic square wave that our own bodies used all the time to move arms, legs, head, mouth, eyes, hands, anything on the body. As a consequence, our clients rarely feel the waves because they are set so low. The whole treatment is undertaken at a subsensory level. That means you can't feel it. And the results are spectacular. It is such a pleasant experience and so relaxing that it causes one to fall asleep. I know, because I do when I use it. We chose an older face to prove and show our facelift works. Unlike the beauty industry, who choose the young and beautiful with an already perfect skin to demonstrate their products, we have chosen the most difficult of subjects to show the results of our facelifts. An older person. You will see her in this presentation in the before and after pictures that follow. As my 86-year-old mother, who had been in the beauty industry all her life since very young, said they didn't show the older or choose the older because the creams rarely work at all. The poor results were of the creams, lotions and potions were demonstrated on TV a year back when many preparations were tested against each other. The result was that hardly any noticeable difference was seen, and they pointed this out to the industry. Here we are. Here's the face before and after pictures of an older woman, and you can see here that on the left-hand side the hanging cheeks, the lines around the lips. The skin looks old and dry. There's blemishes on the skin, especially if you look at the right there on her. And of course the skin is slack around the neck. You can see that it's hanging. Then after the facelift, the cheeks are fuller, the lines are faded around the lips, the skin looks healthy and fluffed out. 95% of the blemishes of the skin are faded away, and the skin around the neck is tightened or taughtened. Now that's on the 6th. You can see there on the bottom, if you look at the bottom left there, you'll see 0 and you'll see 6. That is on the 6th treatment. As you can see, this is a cross-section of skin. This magnified diagram of the skin shows the various layers, including the blood vessels and capillaries. When the probes are present on the skin, the capillaries are opened up to enhance the healthier, fuller look of the skin. If the probes, and we've done this a number of times, especially on older people as well, but younger benefits as well, as drawn across the skin lightly, you don't have to push, the capillaries open and can leave a red line mark across the skin, showing thus that the capillaries are being opened and the blood is being brought to the surface, thus enhancing circulation, which is sometimes lacking. Over a number of treatments, liver and other marks on the skin fade along with lines, etc. Here's the diagram of the all-important mitochondria. The mitochondria produces all the important energy material called adenosine triphosphate, or ATP for short. Without it, we have no energy and nothing operates. In other words, even your heart wouldn't operate. You wouldn't be able to move your arm. You wouldn't be able to move anything, quite frankly, and probably you'd be dead if there was no mitochondria. There are millions and billions of these things all over your body, and especially in your heart. This is the mitochondrial electrical transport, and you can see on the right-hand side here where it talks about the ATP. And this is the system within the cell that holds the mitochondria. Why is it so relaxing? Firstly, the whole process was discovered about 30 to 35 years ago by Dr. Golgi and Dr. Wing, who were given millions of dollars to conduct extensive research on acupuncture. What they discovered was astounding. The experts in China and Tibet said it was the gods, the energies, the forces that operated acupuncture. Dissatisfied with the lack of proper scientific explanation about why acupuncture worked well and sometimes on other occasions failed, these two doctors undertook an all-encompassing study as to why acupuncture worked. What they discovered was astounding, and as a consequence opened up a whole new body of research. Yes, it is true, we are electric beings. The food we eat is converted to fats and sugars, which passes through the stomach wall into the blood. Then clever little cells called mitochondria, which I showed you earlier, mostly found at the conjunction of muscles, like in hearts and muscles on the body, convert these fats and sugars into a substance that provides energy called adenosine. If the mitochondria cell stops producing ATP and an injury such as a line or a wound in that area has occurred or is going to occur, skin hangs, giving heavy jowls, crow's feet around the eyes, wrinkles appear on face and bags under the eyes, and of course the neck hangs. Strangely enough, all the above and more problems are treated with probes that emit subsensory, very low energy frequency pulses. Now if you look here, this is what they found, the positive and negative charge on a human body. The picture of the human body shows two poles. The outer dermis or skin, where the negative charge of the body resides, and then the backbone where the positive charge of the body resides. So those are the two poles, negative on the outer skin and positive on the backbone. If that ever becomes reversed, you or not available there, then you are wounded, you've got a cut, a bruise, a contusion, or you've got some other problem there. Thank you for listening. This is the end of the facelift video, our first one. To obtain more information concerning the highly successful use of microelectronic neuromuscular stimulation, or MENS for short, pain relief, that's PR for short, enhanced tissue repair, ETR for short, enhanced muscle repair, EMR for short, visit our website at faceliftx.co.uk. There you will find further information and contact details. Thank you once again for listening, and we look forward to seeing you on our website.